Let us start.
So, hello, Dr. Tanvir. Welcome to this session with patients. Today, we would like to know from you about embedded infections and microgen testing. So, we would like you to first introduce yourself to our listeners, and then I'll go ahead with the questions.
All right. So thank you, Balika, if I got you right?
Yes.
So I'm Dr. Tanvir, and I'm a practicing gynecologist and also urogynecologist from Hyderabad, that's in India. And I have been with the IC, the GIBS, if you know about GIBS, Global Interstitial Cystitis, since about now, from the time they've started, 5 years or 6 years. So yeah, that's about me. So now talking about a little bit about the microbiota, the normal and the abnormal microbiota that's present in our body and why we get these infections, why it all starts off. It's actually quite a gray area. Unfortunately, even today, there's a lot of confusion regarding, how do we go about it? Why in interstitial cystitis we don't have a permanent solution? Why we cannot figure out what works best? Why does it happen? There's so many questions which are still unanswered. And that's what we are hoping to, study, research, interact with all of you to understand how we can make it better.
So, Dr. I first would like you to just explain to the patients, because many patients, they have heard about the term, but they don't know the technicality of what exactly it means. So, if you first just tell us in very shortly, like in a nutshell, what exactly is embedded infection?
All right. So, before going to embedded infection, would you want to understand what is, what is microbiota?
Yes.
Yeah. So when we talk about microbiota, a lot is being taught today. Initially, urine was thought to be sterile. The bladder was thought to be sterile. It was believed a couple of years back that there is no bacteria in the bladder. But they did find in the gut, and it's proven that as far as the gut is concerned, you have the normal and the abnormal microbiota, or as we call it, dysbiosis. That is some change in the microbiota. So when we talk about healthy microbiome, we mean healthy bacteria, and it is thought to maintain what we call the normal functions. Normal functions as in the ability to fight infection, to regulate the neurotransmitters is how we say it, the epithelial integrity. That is the layer of the bladder. That is what a normal microbiome does. So this is when we talk about embedded infection, that is infection which enters the bacteria that enters through the urinary tract. And what it does is it causes inflammation. That it is a bacteria which does not belong inside the bladder. It comes from the outside. It could come from either using a loo outside, a toilet outside, where like a common toilet, or it could come after sexual activity, or sometimes it comes when a woman cleans from back to front, like after passing stools, she cleans from behind to front. The stool bacteria comes into the urinary tract. So that is when they can have infections. And once it enters into the bacteria, it sticks to the lining. This kind of bacteria, it sticks to the lining of the bladder. And this, it just, it protects, it shields kind of from antibiotics, and it doesn't let, it doesn't let it act so well. Yeah, so this is how they survive, for many years. The bacteria just stays there and survives. If I'm able to put it across right in simple words, I hope I'm able to do that. And they also replicate. This bacteria, if it sticks and forms a layer on the bladder lining, it replicates. And it does not let the body's natural defense, like what I said, the normal bacteria, to act very well. And then what happens is, when you come back with repeated infections, as doctors, we also sometimes, the first thing we do is prescribe medication, antibiotics. And with repeated antibiotics, there is sometimes increased resistance to these antibiotics that can occur.
So what is the connection with interstitial cystitis? Because this one seems more like something that could cause urinary tract infection. So
yes, yeah.
On Sunday evening, and now
I'm not able to hear very well.
Can you hear me?
Yeah, this is good. I think somebody was speaking. Somebody had a question.
Gail had a question.
Yes. Please go on. Please go ahead.
Gail, do you have any question? What I was asking is, what is the connection? This seems more like something that could cause urinary tract infection. So I was trying to understand how is it related, how it can affect interstitial cystitis.
Well, I don't think that this really has a direct connection with interstitial cystitis, if you ask me. And you're right to say it's mainly with repeated infections. So it's just the symptomatology which seems to be similar at times when you have this kind of bacteria, and women complain of some kind of pain, and they go on. I think it's mainly because of the long-term antibiotics that may, cause the uroepithelial or the gag layer. It may cause disturbance over there.
Okay, but most IC patients, they do have a history of urinary tract infections, and
yes,
many believe that this is because of embedded infection. So, what is your opinion?
Yeah. So very honestly, right now we are just getting into this subject of embedded infections and trying to understand the normal and the abnormal microbiota in the bladder. So I would say it's a little early to pinpoint and say that this could be the reason why a woman has IC. But I would, on the other hand, say possibly the long-term antibiotics also may cause, a bit of disturbance leading to, unfortunately, IC. So the Microgen, the microbiology testing that we are doing now, the genetic testing that is coming up, and we also want to start doing to understand the normal and abnormal, then we would have more clarity, Balika. At the moment, I cannot very confidently say that it's because of the embedded infection only.
Actually, I'm not sure if you're aware of.
You may know. Yeah, go ahead. Yeah.
Work of Dr. Maloney, who in fact prescribes long-term antibiotic to cure embedded infection and interstitial cystitis. So there is a huge confusion among patients that should we go for antibiotic treatment, long-term antibiotic treatment, or should we not do this? So what is?
Yes. Long-term antibiotic treatment, we do give in recurrent urinary tract infections, not only in recurrent tract infections, but also when it comes to vaginal infections, that is a completely different thing compared to, yes, I mean, even for vaginal infections, we do give 3 months or 6 months sometimes of suppressive therapy. So what I was talking about is long-term antibiotics, different antibiotics. This is a proven suppressive therapy that we do use in recurrent urinary tract infections.
Recurrent urinary tract infection, that is not interstitial cystitis.
No,
right?
that is not interstitial cystitis. But as far as my knowledge goes, with the confusions that we have and what we follow at the Global Interstitial Group, we prefer not to use antibiotics because they've already been on so many antibiotics for so long until you're diagnosed with interstitial cystitis.
Yes. Doctor, this is a question that I want to ask is that how do you really be sure that this is UTI and not IC? Like, is it only when the urine result come negative, or are there other things that you take into consideration before declaring that this is IC and this is recurrent UTI?
Okay, so your if I can repeat your question, so I'm so much more clear. You want to know the difference between recurrent UTI and IC, correct?
Yes, you can put it that way also. Yeah.
Yeah, so recurrent UTI have some clear guidelines that at least 2 infections in 6 months or 3 or more infections in a year. And then we do rule out tuberculosis in our country. We always do that. Before we think of IC, that's why IC is not thought of much in India, because tuberculosis is extremely common. And a lot of time, empirical treatment is started for tuberculosis. Now, the definition of IC is different in different countries. In India, here it's defined if the pain, the dysuria, that is the filling pain. When you have pain, when the bladder is filling, that is how we describe it, with other lower urinary tract symptoms, and it lasts for 3 months or more. If it's anything more than 3 months, so then we do consider as one of the differential diagnoses, but interstitial cystitis is not taken as the first diagnosis until we rule out everything else. Like we first always think of recurrent UTI, then we also rule out fungal infections causing recurrent UTI, not only bacterial, because in women it's quite common. Fungal infections are quite common, and the testing that we do, the microbiological testing on the urine, you have to specifically ask for fungal infections. They don't give it to you. They don't do it in the panel of testing. It's only the bacteria they test. So we ask for it, and then we also get it tested for tuberculosis. Once we rule that out, we rule out other causes of lower urinary tract symptoms. We rule out overactivity, like if you know about what is the bladder overactivity, or why the urgency occurs, or why frequency occurs, or get an ultrasound done. When everything else is ruled out, then we think about IC and then start empirical treatment.
Okay, before I go into my next question, I think there is one question in the chat. It is from Anish Gupta. It's like, my question is regarding prostatitis. My routine urine and urine culture came back negative, but my microgen testing showed bacteria. So what are the possible treatments for it?
Okay. I treat females, but I can possibly answer this question for you, because if your microgen genetic testing shows bacteria, which bacteria and what's it sensitive to? So normally, yes, we can start treatment, antibiotic for you. In this case, the doctor that you're showing to, or, we possibly would start something for you.
Anish?
Yeah, can I speak?
Yeah.
Yeah, please, Anish, go ahead.
Yeah, actually, I've consulted my local doctor here, my urologist here, but he don't believe in embedded infection. He's like, I don't believe in this Microgen test, and he's not agreeing
Where
to give me any prescription for this.
where are you from, Anish?
I'm from Indore.
Indore. Yeah, unfortunately, when even Balika told me about embedded infection, and uh, honestly, we are not aware of it. We don't do
Mhm.
genetic. No, I'm telling you very honestly.
Yeah.
We don't do genetic testing over here. For
Mhm.
us, with the load of patients that we have, for us, it's simple UTI. There's nothing else that we think about. It's
Exactly.
but
That's the problem I'm
yeah.
facing.
Well, yes, unfortunately, you are facing that problem. So maybe you could get in touch with I don't know Indore who's in the group of Gibbs, but somebody who is now understanding about it. So what we are trying to do is understand the normal microbiome in Indian scenario, which could be very different from what it is in the Western world. So that's a new study that we are trying to get done at my hospital here. So we understand what's normal. See, when we have proof, then we can talk to the doctors around saying, see, this is what it says. So next we go do it in IC patients. So
Okay.
that is a problem that you may face here. So, maybe Balika can connect you with Taneja sir or, Dr. Taneja or Dr. Sanjay Pandey or any other
Okay.
person who understands what we're talking about, because it's very much understandable why your local doctor would not want to give you any antibiotics. He's also worried, I don't want to give anything for this testing.
Yeah, actually, he declared me as in my problem is in my head. He's not agreeing to
Yeah,
what
no,
all
that's
symptoms I'm having.
understandable because we are not taught about all this, and he would not want to just give you something because he finds it in that. But I guess he because we have not opened up in India still. It's too premature, the
Okay.
genetic testing. Yes.
Actually,
Uh,
Dr. Tanvir,
Yeah.
I would like to give you some kind of a context here, which is like when
Yeah.
I started this group,
Yeah.
we did not have any idea about what is embedded infection, what is Microgen testing. We didn't know anything
Correct.
about it. But
Right.
gradually, what happened? Patients they started coming up with questions, that is embedded
Mm.
infection. Then we had to literally Google because the doctors that I work with, I asked many
Right.
of them. They said that in India we don't really have this concept of embedded infection and Microgen
Yeah, we
testing,
don't.
or even if it is
Yes.
there, maybe some labs they do it, but it's not like a common practice. We doctors we usually don't do it.
It's
We usually
only, yeah. Sorry, go
yeah,
ahead.
no, it's only like we follow this process of elimination. And once
Mhm.
we see that it's not TB, it's not cancer, it's not OAB, we kind of start treating for IC. But
Right.
what happens these days, patients also, they are very familiar with the internet, and there are so many Facebook groups, and I
Of
think there is
course.
a trend, if I may use the word, where everybody is kind of talking about embedded infection and Microgen testing and biofilms and all these terms have
Right.
come up. So that is the
Yeah.
reason when you called me and when we had that discussion and you said that you
Right.
want to do a research on this. So I thought
Yes.
maybe if we just have a question and answer session, we can actually uh, know something about it, the what is actually happening and what is something that we are just it's something that is very theoretical and which is actually practically happening. So it's
Yeah. And I hope I'm answering your question, because that exactly the same thing when patients come to my clinic and I see them with so many different antibiotics and pain, and I've seen patients having weekly antibiotics for like 5 years just because they go back with pain repeatedly. And it's sad, but even the doctors are sometimes in a fix, because you have to understand here the loads are too much. You have to spend time with these patients, but sometimes will not be possible. And groups like yours can help. This is what can help even to the doctors to come out with solutions, understanding what really can go wrong.
yes.
And yeah,
So
maybe through
mainly
this
what
we can.
yes,
Yeah.
what I think today what we really need to understand is what is the status of is embedded infection being addressed in India, or is it just
Yeah.
still a theoretical concept? This is something I want to
In
know.
India,
And
it is. Yeah.
Where can
Sorry.
we get where can we get Microgen testing if patients want to get tested for embedded infection? Where
Correct.
they can do it? Yeah.
Right. So as far as in India it's concerned, the embedded infection is not come up, the concept. It could be in research institutes possibly, but whatever research I've looked into, it is not picked up as of yet. First, in India, we need to understand what is a natural microbiota, which we don't have yet in a normal, uncomplicated urine. That means in a urine who has never had infection, a woman or a man who has never had an infection, right? So once we understand that, then we can think about understanding, how the embedded infection works. Because when you talk about biofilm, you're studying about biofilm in India, we don't have the concept of having a normal microbiome itself. And it's going to be very different from the Western world. Our diet is different, our conditions are different, our toilets are different, we don't use paper, they use paper, that everything is so different. So depending on all factors, I think understanding the basic first I've just seen, I think, one paper which was from a microbiological point of view. It was not even from the clinical point of view, not an embedded bladder, but I think something related to the genetic testing, the NSG. The new generation sequencing is what we call, understanding the microbiome in infected patients, like the UTI, acute UTI, urinary tract infection or cystitis, if I may say.
I just want to ask a question that came in my WhatsApp. This is from Dr. Nupur. She's a patient.
Okay.
So she's like, worldwide, there are many doctors who believe that interstitial cystitis is just an umbrella term, which means generalized bladder inflammation and symptoms related to that. There is always a root cause which give the symptoms. Some urologists in USA follow Ruth-Chris protocol or Microgen testing to find bacteria normally not found in routine outdated urine cultures. A long-term antibiotics can cure it forever. There are thousands of patients getting relief now from long-term antibiotics. What is our say other than side effects of long-term antibiotics?
When you say long-term antibiotics, how long are we talking about?
Some patients, I think they are also taking for more than 2 years.
Pardon?
Some patients abroad, I know those who are taking long-term antibiotics, I know some of them are taking it even longer than 2 hours. 2 years.
2 years.
Sorry. Yeah.
Okay. Yeah. Well, is this study a randomized trial? That's the first question. Or is it a retrospective study, or is it a prospective study? Because
Ruth-Chris is, if you are aware of her, she is treating patients in US with this embedded infection and the long-term antibiotics. So her patients, they say that we are getting relief from this antibiotic treatment, and Dr. Nupur is talking, I think, probably about her patients, and of patients of Dr. Maloney Lee from UK, who is also using the same method, the same protocol for treatment, which is like they are just giving long-term antibiotics and they are just checking for biofilms and all this. Patients, they say that they are getting cured. Yeah.
Oh, patients say they're getting cured.
But by the way, Dr. Nupur is just coming. I think she will.
Yeah, that would be good. So, how long is the relief? Is it like it's a complete relief, or is it just a short-term relief and again they go back on antibiotics? Is it like that? Because no, I have not heard about Miss Ruth, and we being evidence-based, does she have any publications? Because now we do go by evidence, and if she published, yeah.
Yes. Dr. Nupur? Hello, Dr. Nupur?
Hello.
Yeah,
Hello?
Dr. Nupur?
Sorry, I got a little late in joining. I'm so
Yeah,
sorry.
I
There was some
just
issue.
asked your question just now. Right now, I asked your question to Dr. Tanvir regarding Ruth Crit's testimonials and all. So, Dr. Tanvir would directly like to ask you a few things. So, just over to you.
Yes, Dr. Nupur. So,
Yes.
yes. Balika was telling me about Miss Ruth, who's treating IC. Now, if I may know a little bit about what she's doing, she said she's giving long-term antibiotics. Is that correct?
It's actually Ruth's protocol, actually, at which there was one lady. She was a practitioner, a nursing practitioner, I guess, and she was in early 19th century, and then what she started doing was that she was titrating the doses regularly, that for some time she'll give particular antibiotic, and then after some time then she'll do the testing again and then give the antibiotic accordingly. So it is what she does, and many doctors in US follow this Ruth's Carl protocol, what is this called.
Okay, so I wouldn't know what antibiotics she uses, but could you just enlighten me a little bit on what would her protocol be? If
I don't know very much in detail.
I'll just share the link of her website. Just
yes, that'll be great.
Yes, just
so coming, yeah.
You can just carry on I need to search a little bit.
Okay, sure.
Actually, I have Dr. Tanvi.
Yes,
I have recently started consulting Professor Maloney.
All right.
Because for me, my UTIs were for past 4 years. I suffered only from UTIs, and then after that, I got interstitial cystitis symptoms.
All right.
So for me, I always feel the root cause is UTI.
Yeah, possible. Could be. Or it could be a long repeated use of antibiotics. Or would you have been diagnosed with anything else?
No, a urogynec once diagnosed me with interstitial cystitis, but on cystoscopy also only the bladder wall was inflamed. It can be due to repeated infection as well.
Yes, absolutely. I mean, to get the lesions that we talk about, the Hunner's lesions, typical lesions may not be there in everyone, and sometimes if you've had also in women, we notice that we're trying to understand whether estrogen has a role. We're not too sure yet, but we're just trying to understand, would estrogen help reducing this kind of a problem, or does it aggravate this interstitial cystitis kind of a picture? Because a lot of times, even PIDs, if you know the chronic pelvic inflammatory diseases that women come with to us, so we're just trying to follow up some of these patients and see whether they land up with this chronic bladder pains and infections or cystitis, because we are not, these are very gray areas which we are yet to understand. So what we started doing, keeping all the causes in mind, because we deal with women, what we try to do is help her for a long-term pain relief. That's the most important thing, isn't it? If I may ask all the people who've joined in, what is the most important thing that you're looking for? Relief from
pain
what?
relief.
Exactly. So even now, women who come in early to us, what we've started doing is give them advice on certain simple management, follow them up, tell them on how to go about it to prevent repeated infections, and look for chronic pains, not only in the bladder, but otherwise, chronic back pain, chronic constipations. These are all interrelated.
Right. Dr. Tanvi, can I ask you something, please?
Yes, please. Go ahead.
Ma'am, actually, I've been suffering from vulvodynia as well. So
Okay.
when I started taking antibiotics as advised by Professor Malone Lee's team in UK,
Okay. Okay.
they gave me cephalexin 2 gram daily. So right
Okay.
from the second dose, I started flaring for vulvodynia. Then they
Oh,
changed me antibiotic to trimethoprim 200 mg twice a day.
all right.
I took it 2 days and again I started flaring for vulvodynia. So is there any relation between antibiotics and vulvodynia flare?
No, no, not that I know of.
Just a moment. I'll just this time may just it's remaining time is only 6 minutes. So once you the meeting ends, just re-log in. Okay.
Okay, all right.
Yeah. Sorry.
Yeah.
Sorry to interrupt. Yeah.
Yeah, so for vulvodynia, are you on any local creams like gabapentin?
Yeah, I'm on gabapentin oral medication. I take
All right,
400 mg once a day, HS.
once a day. Would
Yeah.
you also try using a local, cream or something?
I have
Okay.
tried many things like
Okay.
gabapentin ointment mixed with lignocaine. It gives me immediate
Correct.
flare. Nothing suits me
Have you
down
tried
there on skin.
injectables?
No, I haven't tried yet.
Yeah, so there is also now, that is also being tried, local injections. See, the thing
Mm-hmm.
is, you may not be completely relieved, but
Mm-hmm.
it may give you a long-term relief, maybe a couple of months. We are not too sure.
Right.
Again, these are things that are being tried. So you may need
Okay.
sometimes repeated injections. So there's a new society in somewhere in Europe. They've come with something called neuropelviology.
Okay.
It's called neuropelviology. It's
Right,
a
ma'am.
society which deals only with nerves, the nervous system. So
Right.
pains, especially the pelvic pains, what they find is they're trying to target the nervous system in the initial time so that it doesn't go, to the extent where the nerves are so sensitized that it's difficult to get it back, right? Like
Right.
maybe happening in some of your cases where you have this chronic pains and it doesn't help. It just gives you relief for a short time. So ideally
Right.
the brain, the brain just becomes very sensitive,
Right.
even sometimes to a touch. So they're trying to locate these nerves in the spinal cord, in the end organ, and trying to treat it at that level before if they could. So injections is something that they are encouraging at the moment because they're blocking the nerve, right? You just give an
Right.
injectable and block that nerve. So it may give a little better relief than just using a superficial cream and a little long-term relief than what you would get from using
Right.
a local cream and tablets.
Right.
Yes, you have to maybe, to maintain certain levels. Unfortunately, your tolerance level goes up and then you have to increase your dose. That's
Yeah,
the
that's
problem.
actually happening with me. Actually, the
Yeah.
same is happening with me. Just 2 months,
It
I
would.
have the dose to double.
Yes. So also did you try physiotherapy?
Ma'am, I've been doing physiotherapy online, but it's a little
No.
difficult for me to find
No,
a
yeah.
pelvic floor therapist in India. I don't know.
Okay. We have one. So, if but where are you from, Nupur?
Ma'am, my husband is in army and he's posted in Odisha these days.
He's in Orissa. All right. So we are in Hyderabad. So what I can do and ask my physiotherapist if she knows anybody in Orissa. Again,
Ma'am,
the
I'm ready to
same.
come to Hyderabad.
Yeah, you could.
Because I'm in so much of pain that I can travel.
Yeah. Yes. So she may actually help you to a certain extent for at least certain time. And she's been doing that now with us. And there are a couple of patients who have had relief, but then, it comes back. That's what you have to remember. It may not be a permanent solution. And then she'll give you some tips on how to have relief for whatever time. So we may try to reduce your dose that way.
Right.
Physiotherapy does help because the examination is very important. Online is good, but I'm not sure. At least initially, it's important to examine.
Right, ma'am. Ma'am, I'll take your details from Ms. Balaka then.
Yeah, sure.
I think
You can.
I think Anish has left a question for you in the chat.
Yes. Okay. Can you recommend a doctor for male patients who believe in embedded infection and follow treatment protocols? I would say Rajesh Taneja, sir. Yeah. In Delhi.
Okay. Okay, ma'am. Thank you.
Yeah, because I know he is into research. Sir is updated. Right, Balika? Would you agree with me?
Yes,
Yes.
Dr. Taneja, and moreover, Dr. Taneja, I think he is that kind of a doctor who doesn't judge you. Like he will
Exactly.
let you do what
He'll
you
let
want to.
He understands, and
Yeah,
he's got, I mean, he's got a huge experience. And what, I mean, among all the doctors that I have seen, I mean, his interest is, he's a lot into research. So he's very updated.
Yes.
Okay.
Is what I felt. So, you know, research, why is research important? In India, the concept of research is very different. I think research is very important because it helps us treat you better. So
Oh, 1 minute remaining. So I think we will
All right.
have to re-log in. And
Should we
one
log
question,
out, or should we just
one
wait?
question is there. No, we will wait. One question is
Yeah.
there in the chat. I think meanwhile you can just answer it.
Yeah. What is it? This is the only question. I can't see any other question.
Only one question. Richa has asked.
Yeah, I think that's already done, right? That question is already answered.
Yes.
Yeah.
Yes. Richa, if you listen to the recording, once I post it, then you will get the answer. We discussed it in the very beginning.
Okay.
Yeah. So,
so when we log in again, I would just want to know about each one of you and what you know,
yes,
are
and
going
we
through.
would like to know about what are your plans regarding this research.
Microbiome study?
Yeah.
Yeah, sure. Yes.